Hello, this is Dr. Praveen Ramachandra. I'm senior endocrinologist working in Diaplus Endocrinology Clinic, Yelahanka, Bangalore, India. Please watch this video.
Welcome back to The Explainer. Today, we are unpacking a really, truly monumental shift in women's health and endocrinology. What we're looking at today is a critical piece of patient education, and it comes to us directly from the Diaplus Endocrinology Guidelines. These were actually put together by Dr. Praveen Ramachandra, who is a senior endocrinologist at the Diaplus Endocrinology Clinic over in Yelahanka, Bangalore, India. So, if you, or maybe someone you love, has ever struggled with things like unexplained weight gain, irregular cycles, or even really frustrating skin issues, only to be handed a kind of confusing diagnosis, well, you need to pay close attention to this. We are looking at a fundamental change in how a very common disease is recognized, diagnosed, and ultimately treated.
Okay, let's dive into this. The major breaking news here, and I mean, this is a massive shift sweeping through global medical guidelines right now, is that the highly recognizable term PCOS, a name we've relied on for nearly a century, is officially being retired. Yeah, you heard that right. Starting with a major global consensus announcement in 2026, the medical community is moving to a brand new name, PMOS. That stands for Polyendocrine Metabolic Ovarian Syndrome. And look, this isn't just some simple PR rebranding exercise or a minor tweak to medical jargon. No way. This is a fundamental correction in how doctors actually understand the disease, and more importantly, how patients experience their care. Notice the stark contrast between these two concepts. In the past, the old PCOS view targeted almost entirely on the reproductive system in total isolation. But the new PMOS view, it forces us to pan out and see the bigger picture. It fixes this massive historical misconception that the condition is only about the ovaries. When you put these two acronyms up against each other, it's pretty clear, right? The medical community is completely shifting from an incredibly narrow, localized view to a much more comprehensive, whole-body perspective. So, to really understand why this change is happening, we have to talk about the massive problem with the word polycystic. Honestly, the old name was incredibly misleading. First and foremost, it drastically overemphasized ovarian cysts. And the problem with that? Not every patient with this syndrome actually has ovarian cysts. Actually, scratch that, it's worse. Because the name focused so heavily on the ovaries, it actively masked the broader underlying realities of the condition. We're talking about severe metabolic issues like unexpected weight gain, profound insulin resistance, and hormonal skin issues like severe acne. Because of that old name, both patients and their doctors were routinely underestimating the true severity and scope of the condition. It was being treated as a localized issue rather than the systemic one it actually is. Let's break this down a bit and deconstruct our new acronym, starting with the P, polyendocrine. Honestly, this is arguably the most important shift in the terminology. Polyendocrine directly reflects that there are multiple hormone systems involved throughout the entire body. It's not just a single, localized hormonal misfire. We are looking at widespread endocrine imbalances. Most notably, we're talking about androgen excess, which is an overproduction of typically male hormones. And that drives a whole cascade of symptoms far beyond anything strictly gynecologic. Using polyendocrine immediately sets the right expectation. We're dealing with a complex hormonal web here. So the crucial point is the M, metabolic. This letter is an absolute lifesaver, really, because it shines a massive spotlight on the insulin resistance that plagues so many patients with this condition. By baking the word metabolic directly into the actual name of the disease, it screams to clinicians that metabolic screening isn't just some optional extra. It is a critical necessity. It demands that doctors look at the long-term cardiometabolic risks. It essentially tells us that managing this condition isn't just about the present moment. It's about safeguarding the patient's long-term heart and metabolic health for decades to come. Next up, we unpack the O, ovarian. Now, the medical community obviously didn't want to completely erase the reproductive realities of the disease. That wouldn't make sense. Reproductive symptoms like irregular cycles and those really heartbreaking battles with infertility are still incredibly valid and recognized. But by placing ovarian at the very end of the polyendocrine and metabolic descriptors, these reproductive symptoms are finally properly contextualized. They're recognized as a symptom of a much larger multisystem disorder, rather than being the singular defining feature of the whole shebang. When you bring all these systems together, it reveals the true, undeniable picture of PCOS. It is a true multisystem disorder. It encompasses the endocrine imbalance, the significant metabolic and cardiometabolic risks, the reproductive and fertility issues, chronic skin conditions, and, crucially, the mental health impacts. Having this comprehensive view guides clinicians to evaluate a patient's mental well-being, their skin health, and their metabolic blood work.
It completely destroys the old, outdated habit of treating this merely as a menstrual problem to be simply fixed with a single localized treatment. It's a real game changer. Now, if you're a patient or a loved one trying to navigate the medical system right now, you might be wondering about the timeline for this massive shift. Well, the rename was officially announced as a global consensus for 2026. Right now, we're kind of in this gradual transition phase. And this is important to know because you might still hear your doctors use PCOE or PCOS in day-to-day practice today. Don't panic if they do. Change takes time in the medical world, as we all know. However, the target for full universal implementation across all international guidelines is 2028. The transition is meant to be gradual rather than abrupt, just to allow the entire global medical community to get on the exact same page. And this brilliantly illustrates the entire rationale behind the transition. Listen to this simple, elegant, and super patient-friendly explanation directly from Dr. Praveen Ramachandra, the senior expert over at the Diaplus Endocrinology Clinic. He hits the nail on the head here, noting that endocrinologists now recognize it for what it truly is, a hormone and metabolism disorder. Honestly, this is exactly how you can explain it to your friends, your family, or even gently remind your own care providers. It's not just a problem of ovarian cysts. It affects many body systems, not just the ovaries. Ultimately, you might ask, why does any of this terminology stuff even matter? Well, it matters because of the real-world clinical domino effect. A better name leads to better recognition. Better recognition leads to earlier and much more accurate diagnosis. And for sure, a more accurate diagnosis absolutely leads to better, more comprehensive treatment. This renaming literally empowers you as a patient to advocate for full-body screening. It forces the medical community to take a comprehensive, long-term approach to your care. It actively reduces the really common and sometimes dangerous mistake of treating this condition as a simple fertility hurdle, especially when long-term risk reduction is absolutely vital. Which brings us to our final thought for today. If the name fundamentally changes how we see the disease, how will this new PMOS framework change your personal health journey? Well, the bottom line, as heavily emphasized by the Diaplus Endocrinology guidelines, is that this is, at its core, an endocrine disorder. It's a whole-body condition that requires a whole-body approach. So take this knowledge, ask the right questions at your next appointment, and make sure your metabolic and endocrine health are being prioritized just as highly as anything else. Keep learning, keep advocating for yourselves, and we'll see you in the next explainer.